Hello, everybody. Hello, hello, hello. We're going to be getting started with the live in a moment. This is the first day of Mental Health Awareness Month. All right. So let's see. So I'm going to share the video. Bear with me. Bear with me. Bear with me. All right. All right. We're supposed to start at 5:15. Is when we're going to start the live. Okay. I'm just trying to share the video to multiple pages. Let's see. Okay. Let's see where else we could. Give me one moment. We're 2 minutes away from starting. Happy first day of Mental Health Awareness Month. All right. Let's see. Okay. Let's see. All right. All right. All right. All right. We're going to get started soon with depression, quick burst, educational topic. If you didn't know, this is the first day of Mental Health Awareness Month, the whole month of May 2020. So I'm just sharing the information to another page. Give me one moment. We're actually 1 minute out and we'll be getting started. Let's see. Please share the video. Whoever tunes in, please share the video. This is information that everybody can use because mental health issues affect everybody everywhere, no matter who you are, no matter where you live, no matter how much money you have. Everyone has dealt with or will deal with some type of mental health disorder, whether it's directly or indirectly. So today, our topic is depression. All right. So I'm just going to give some educational points. This is going to be it's going to be a quick burst of information just to kind of educate people on certain components of depression, because this is one of the more common mental illnesses or mental health disorders in the United States, actually the world. Depression is something that, even young children can deal with, all the way up into our elderly. And if you didn't know, the elderly population are committing suicide at astronomical rates because of depression. And a lot of times we know that the depression for elderly is in regards to, hey, I'm not able to do what I used to do. I'm not as independent as I was. So make sure you're looking out for your elderly population because they are a very prime target demographic group for depression. Again, because if you're used to doing everything for yourself and you're used to being independent and things like that, and you're no longer able to do that, someone has to wash you up, someone has to take you shopping, someone has to do all of the basic things that you were able to do yourself. All right. And now you're no longer able to do that. That will lead to some form of depression. Now, depression let me not get a hold of myself, but I'll just finish this point. As it relates to the elderly population, depression, as with anyone, comes in various aspects, various levels of severity. But make sure you're looking out for our elderly population, because that demographic of people specifically are committing suicide at astronomical rates. So make sure, you're checking on your grandparents, the next door neighbors, the elderly people at your church, the elderly people that you work with, maybe on your jobs. Check on them. But we're just going to be approaching real quick the topic of depression as it relates to a general perspective, but it's also referred to as depressive disorder, but depression is more than just a feeling of sadness or going through a rough patch. Depression is it's a serious mental illness, a mental health disorder that requires proper understanding and medical care. We can't keep crossing depression off as something I'll get over it and make it through, because that's not always the case. As with any sickness, as with any illness, as with any disease, disorder, however you want to term it, without proper treatment, there is no way you can get well. So just like, if you have kidney disease, you need treatment in order to get well. If you have heart disease, you need treatment in order to get well. Whatever that treatment is for you, it depends on the patient. The same with depression and any other mental health disorder. We gotta stop thinking that we'll just get over it with willpower, or, if I just think hard enough, or if I just will my way past this, or if you can't do that. You need treatment. All right. So now let's see. Left untreated, depression can be devastating for those who have it and their family. Understand something. Whenever anyone is dealing with, any mental illness, mental health disorder, mental health problem, those are all used interchangeably. They're not the only ones that's dealing with it. Like if you have a mental illness, like everyone around you is going to feel the effects of that one way or another. All right. So whether it's your coworkers, whether it's not even just your family, your coworkers, family, friends, loved ones, and even strangers, coworkers at work, whatever you're dealing with, you have to understand that there are going to be other people dealing with it too from an indirect perspective. So if you have someone that's dealing with a major depressive disorder, trust me, they're not the only one that's going through it. They may be feeling the firsthand effects, but guess what? The people around them, relationships, are going to be affected, because of what they're dealing with. Now, fortunately, with early detection, diagnosis, and a treatment plan, as I mentioned, consistent of medication, and we'll go over this again, medication, psychotherapy, healthy lifestyle choices, people can and do get better. Understand something. Depression is not a death sentence. You can be healed and whole from any condition. I'm a firm believer that there is no problem that exists, okay, in this earth that doesn't have a solution to it. Now, whether we find the solution for our individual problems or our collective problems is, another story to be told, but there is always a solution to every problem. And I believe no matter how severe your depression is, or your depressive symptoms are, you can be healed and whole. And this goes for everybody. This is more on the educational tip. Now understand something. Some people will experience one depressive episode in a lifetime. But for most, depressive disorders reoccurs over time. Okay. And without treatment, episodes of depression can last few months to several years. So just like with any condition, if you don't put the proper wellness tools or treatment components in place, the condition is going to grow worse. And especially a disease of the mind, or the disease of the emotion, because depression affects your mental status and it affects your emotions. So that's why I like to talk co-currently about mental and emotional health, because all mental illnesses at some point affects your emotions as well, your emotional stability. All right. So now, here are these stats. More than 17 million U.S. adults, that's over 7% of the population, had at least one major depressive episode in the last year. Okay. Now, people of all ages, hear this. So you don't think you're exempt from having, especially people in the Christian world, having a relationship with Jesus doesn't exclude you from depression. Okay. Being strong-willed, being focused, being centered doesn't exclude you from having bouts with depression. Okay. So hear this. People of all ages All racial, ethnic, socioeconomic backgrounds experience depression. Please, if you're coming on, please share this video. This is an educational video. I'm just trying to educate some people as it relates to the topic of depression. All right. This is the first day, once again, of Mental Health Awareness Month. But people of all ages, racial, ethnic, and socioeconomic backgrounds experience depression, but it does affect some groups more than others. Now, I do want to mention this. The Diagnostic and Statistical Manual of Mental Disorders, or as it's known in the psych world as the DSM-5, it defines depression as needing two criteria, by definition, that it consists of a depressed mood with regards to sadness or negative emotion. And then the second criteria is called anhedonia. Anhedonia. And that's Anhedonia, anhedonia. That is when you have no pleasure or no interest in doing the things that you normally do. Those are the two components, according to the DSM-5, that defines what depression is. Again, depressed mood, those are the two criteria. Depressed mood, like you have sad and negative emotions, and then anhedonia, you have no pleasure or no interest in doing the things that you normally will enjoy doing, okay? Now, depression can present different symptoms depending on the person and the level of severity of the underlying stressors. Okay, so once again, depression can present different symptoms depending on the person and also depending on the level of severity of the underlying symptom. So if I'm depressed, it's not going to manifest. We can both have major depressive disorder, or it's also called clinical depression. We can both have that same condition, but it's not going to manifest in my life the same way it will your life. You know why? Number one, there's multiple factors involved in environmental, familial, just where you're at in life, the support system that you have around you, different social factors that could be going on. So you have to understand depression. When we hear depression, just understand it's a wide range of conditions because it's going to look different for every person that it hits. Okay. Now, let's see. Common symptoms. I do want to talk about common symptoms of depression. Please share this video. Some common symptoms of depression. You have the somatic symptoms, and I'm going to give you some scientific terms that you will hear in the psych world. But you have the somatic symptoms, and then you have the non-somatic symptoms. The somatic symptoms are those that directly affect your physical being. And the non-somatic symptoms of depression are that which affects your thought and your emotion, okay? So some of the somatic symptoms, the things that affect when it comes to depression that affects your physical body. When you're going through depression, you have changes in sleep pattern, you have changes in appetite, you have lack of concentration, your energy, lack of energy, you feel drained and fatigued all the time. And the last somatic symptom would be changes in your movement. Your reaction times are a little bit delayed, or you get a little fidgety with regards to your movements. Okay. Now, as mentioned, those were the somatic symptoms of depression, that which affects your physical body. Now, you have non-somatic, okay? Non-somatic are the things that affect your thought and emotions. So, lack of interest in activities, that's one of the criteria by definition of what depression is. You have a lack of interest or enjoyment in the activities that you normally enjoy. Number two, let's see. Hopeless or guilty thoughts. You feel very hopeless. You feel very guilty for whatever reason. And then also suicidal ideations or thoughts that come across you. Those are the non-somatic symptoms that depression can often bring. Now, here's the thing. You have people that deal with depressive symptoms, and then you have people that are actually dealing with clinical depression. Now, clinical depression and major depressive disorders are interchangeable terms, okay? So you have to, this is why we can't have people diagnosing themselves. We live in a generation where whenever something happens to someone, they're getting some type of symptoms, they're experiencing various things, they hop on Google and start asking, what's wrong with me, okay? Stop doing that, because some people that are just simply dealing with the blues or just feeling a little sad, because because they typed in how they're feeling and things in Google, now it's telling them they may have major depressive disorder or clinical depression. Listen, that's not it, okay? So you have to, this is why, just like you would go to a doctor to be formally diagnosed with testing, the same thing. You don't want to diagnose yourself. It's hard enough for a mental health professional to diagnose a person, okay? If it's hard enough for a mental health professional to diagnose their patients, you who have no educational background, you're not a professional. You shouldn't be diagnosing yourself. Okay, now. There is certain criteria that must be met before it is deemed that a person has clinical depression or major depressive disorder. Okay, so this is why, again, that we can't be diagnosing ourselves. Now, what is the criteria? Because you can be dealing with depressive symptoms, where you could be dealing with changes in sleep patterns. You have no interest or enjoyment in doing the things you want to do. It comes and goes in spurts. You're dealing with depressive symptoms, but when you're dealing with when you've been diagnosed, I should say, with major depressive disorder or clinical depression, again, those terms are interchangeable. There's criteria. The criteria is this: at least 5 of those symptoms, those somatic symptoms and non-somatic symptoms, must be present majority of the days, at least 2 weeks out. That's the criteria for major depressive disorder and clinical depression. So, for instance, for clarity's sake, if you've been dealing with, let's go back over it again. Somatic symptoms are the things that affect your physical body associated with depression: changes in sleep patterns, changes in appetite, lack of concentration, loss of energy, you're very fatigued, and then also changes in your movement. Your reaction times are delayed or you get fidgety. And then the non-somatic, that which affects your thought and emotions: lack of interest in activities, hopeless or guilty thoughts, and suicidal thoughts and ideations. Okay, once at least 5 of those things, and especially lack of interest in the things that you often enjoy, if 5 of those concepts, those symptoms, are present most of the days of the week for at least 2 weeks, generally speaking, a mental health professional, or sometimes, some cases, your primary care physician, will diagnose you with having clinical depression or major depressive disorder. Again, you have to have 5 of those 5 of those symptoms of depression most of the days for at least 2 weeks before you are technically clinically diagnosed as clinically depressed or major depressive disorder. So listen, you may be having the blues, like I said, because you can't pay no bills, you ain't got no money, you may have lost your job. It doesn't mean that you're clinically depressed or you have a major depressive disorder, because sometimes people, like I said, this is where the criteria comes in. You may just be a little sad, maybe a little blue because of circumstances. But if this stuff comes and goes, you're good most of the time. Every now and then you may have a little bout with something because of a situation. Doesn't mean you have depression, clinical depression, or major depressive disorder. Some people, again, as I mentioned about 6 minutes ago, are dealing simply with depressive symptoms. Doesn't mean that you that you are depressed per se. And again, stop diagnosing yourself. Now, what are some of the causes of depression? Now, we want to kind of pinpoint this because we've talked about how 17 million U.S. adults, which is over 7% of the population, has had at least one major depressive episode in the past year. But now we talked about the symptoms, somatic and non-somatic. Now we need to talk about causes. What brings about depression? Okay, remember I say depression has a different face depending on who's wearing it, depending on who's dealing with it, I should say. Okay, it's not going to manifest in me the same way as you and vice versa because of various reasons: environmental, social, familial, and the list goes on. Okay, but depression does not have a single cause. It can be triggered by a life crisis. Depression can be triggered by a physical illness or many other things, but it can also occur spontaneously as well. Scientists believe, though, generally speaking, that several factors can contribute to depression. Let's see. Number one, trauma. This is one of the biggies. Trauma, when people experience trauma at an early age, it can cause long-term changes in how their brains respond to fear and stress. These changes may lead to depression. So that's one of the more common considerations as it relates to the causes of depression is the events that happen in people's life dealing with trauma, various traumatic events. And that looks different for everybody because what I consider traumatic may not be traumatic for you, okay? It can be something as simple as seeing a dog being ran over, and that can become a traumatic experience that a person begins to live out when, someone else can see a dog get ran over, and it's just like, oh, that was just a dog. You see what I'm saying? So it looks different for everybody. So that's why we have to be considerate, and we have to make sure that we're not downplaying the experiences and what people are dealing with in their own life, okay? Now, another cause that a lot of scientists and doctors, mental health professionals delve into as it relates to the cause of depression is genetics, okay? You ever heard people say like diabetes run in my family or heart disease run in my family? Guess what? Mood disorders, mental health disorders, such as depression, anxiety, and everything else, but we're talking about depression today, can also run in our families. There are genetic markers that indicate such, okay, that predispose us to certain conditions. It is not just the physical conditions, okay, that affect us, that runs through our family that we often inherit, and we have to work hard so that we don't succumb to what runs in our family. The same thing, again, with this, mood disorders such as depression. Guess what? You have to work hard for various reasons and for various causes to make sure that if this is something that's in your bloodline and your genetics, as they say, that you don't succumb to it. And there are various things we can do, and we can get to that later as far as treatment and wellness tools are concerned. Another cause of depression is dealing with life circumstances, whether it's marital status, relationship changes, financial standing, and where a person lives influences whether a person develops depression. It does. Again, marital status, relationship changes, financial standing, where a person lives, who they're around, their social circles, all of these things play a factor. These are life circumstances. So we talked about the first cause we talked about as it relates to where does depression come from in a person? Traumatic experiences. The second thing we talked about was genetics. The third thing is just simple life experiences. When people don't have a good control on the stressors that come about in their life, they don't have wellness tools in place. They're living a sedentary lifestyle. A lot of time, though, life circumstances and the stressors associated comes along, right? It comes along and it cripples that person. Why? Because they haven't put the proper wellness tools in place. And perhaps maybe they don't know what wellness tools exist or even what treatment options are available. But this is why we have to start being educated, whether you are in the mental health professional field and whatever facet, or whether you're just a regular civilian. You need to know because when you have family, friends, loved ones, and even strangers, and you're noticing some odd patterns in the people's lives, just being educated in the mental health field will help you just identify something is wrong and I need to try to intervene. Okay. And don't try to go beyond your measures. Don't try to diagnose somebody. Don't try to tell them, oh, you might be dealing with A, B, C, or D. It's not your job. We just need to learn basic strategies to assist someone that we perceive may be dealing with depression or depressive symptoms, or distress or whatnot. Now, another cause of depression is brain changes. Your imaging studies have shown that the frontal lobe of the brain becomes less active when a person is depressed. Depression is also associated with changes in how the pituitary gland and the hypothalamus respond to hormone stimulation. So again, if you already have a brain disorder or a brain malfunction, something is going on, as it mentioned, especially with your frontal lobe, but it can happen with the temporal lobe, the occipital lobe, the parietal lobe, any malfunctions with your brain defects, brain disorders can become prime substance for depression developing, depending on other factors in that person's life. So I'm not saying if you got any type of brain injury that you're automatically going to develop depression. It's possible, And it's more likely it's not 100% because nothing is 100%. So don't take what I'm saying and say, oh man, because you could have a brain injury, oh, I'm going to have to be depressed. That's not what I'm saying. But that is one of the major causes. Okay. Other medical conditions. What else causes depression? Other medical conditions, people who have a history of sleep disturbances, medical illness, chronic pain. And that's a big thing because, I've been working with the same medical organization for a long time. And believe it or not, when somebody is in constant pain, day in, day out, hours of the day, it's like the pain never subsides. That begins to cause a mental health problem, I should say. Okay. And in this case, depression, that can lead to depression because most people, no one in their, in their healthy mind will want to be in pain. So if you're dealing with pain, you're dealing with the same issue and you can't find relief, that's going to shift you into a depressive mindset. Okay. So yes. Medical illnesses, chronic pain, anxiety, and attention deficit hyperactivity disorder, also known as ADHD, are more likely, people who deal with that are more likely to develop depression. And again, if you have ADHD, I'm not saying you're automatically going to develop depression, but those people are more likely to at some point. Now, some medical syndromes like hypothyroidism can mimic depressive disorder. Some medications can also cause symptoms of depression. So you got to be careful what kind of medications you're taking. Even when your doctors, your primary care doctors, your specialists, your heart doctors, nephrologists, whoever are putting you on various medications, you have to be careful and make sure you stay educated in what the doctor are putting you on. Yes, we trust the doctor and we think they know what they're talking about because they're treating us. But you need to know what prescription the doctor is giving you, what medication they're prescribing to you, how often you need to take it, what are the side effects, because a lot of medicines do affect your mental status and your emotional stability as well. Okay, remember that. Now, the other thing too, another cause of depression is drug and alcohol misuse. 21% of adults with a substance use disorder also experience a major depressive disorder, and this was as of 2018. Co-occurring disorders require coordinated treatment for both conditions, as alcohol can worsen depressive symptoms. Here's the thing. This is the catch, because we're talking about causes of depression. We talked about, number one, traumatic experiences, and never downplay the experiences of anybody or what's going on in their life, because what's traumatic for one may be normal to another. Okay. Just be considerate on that. Genetics, just like diabetes and heart disease can run in your family, so can mental health disorders. Life circumstances, depending on the woes that come with life, the trials and tribulations. And most of the time, it's people who don't manage those stressors well with the life situations. That's why they succumb to depression. When you have physical defects in your brain, I'm just going through a quick recap, and other medical conditions, whether it's chronic pain, whether it's other medical illnesses, those can spark depression or depressive symptoms. Now, here's the thing with drug and alcohol misuse. Not everybody give me 1 second. Let me just make sure. All right. So not everybody that gets on, that begins to abuse drugs and, alcohol and things like that are depressed. That's a common misconception, that everybody that abuses alcohol and drugs are depressed people. That's not always the case. And although, abnormal use of alcohol and engaging in any type of drug abuse, even recreational drugs, over the counter, prescription, whatever the case may be, doesn't always mean that you were depressed when you started that. Certain people started out of curiosity, and then over time they just develop habits. Now, if you have a habit of drug or alcohol abuse, that can spark depression. Okay. So understand something. So if you have somebody with a drug or alcohol problem, it doesn't automatically mean that they got on drugs and alcohol because they were depressed, but now they need to have some type of intervention. Why? Because they can soon drift into depression, I should say, without timely intervention with regards to their drug and alcohol addictions. Okay, so we want to make sure, and like I mentioned, there are criteria that must be met. So don't go trying to diagnose yourself, and I encourage you, whether you're Christian, and I definitely want to deal with the Christians, it's okay to go see a therapist. It's okay to go see a counselor. It's okay. I know many times we say, that means you don't have faith in God if you go see a counselor or if you go see a therapist, but it's simply not true. Okay. Just like if you broke your arm, you may pray, but you're going to go see the appropriate specialist to help you repair your arm. Or if you're dealing with some type of kidney issue or kidney disease, you may pray, but you're going to go to see the appropriate specialist that can help facilitate healing and wholeness. Okay. The same thing with depression. If you're feeling like you're depressed, or you're dealing with depressive symptoms, or your stressors in life are becoming overwhelming, you need to consider talking with someone, therapist, a counselor, or even peer and family support groups. Okay. Because guess what? Without timely intervention and treatment, the condition can go from minor to major. It can go from something small that could have been corrected with intervention to something big. All right. So you have to be careful with that. Now, once again, I just want to reiterate this. To be diagnosed with major depressive disorder or clinical depression, a person must have experienced 5 of the somatic and non-somatic depression symptoms most of the days for at least 2 weeks before technically a mental health professional or your primary care doctor will diagnose you formally with having clinical depression. Once again, just to recap, what are those symptoms? The somatic symptoms, once again, are physical symptoms, things that affect your physical body. Okay. Changes in sleep pattern. These are the symptoms of depression. Changes in sleep pattern, changes in appetite, lack of concentration, fatigue, lack of energy, and then also changes in your movement. When you struggle with your reaction times, it's either too fast or you're too slow. Those are somatic. And then the non-somatic, you're feeling hopeless or guilty thoughts, suicidal thoughts. You have no interest or enjoyment in the things that you normally enjoy doing. Okay. Now, so we're just really about at the end of this. What are the treatments that are available for depression? Okay, people that are dealing with major depressive disorder or clinical depression, or those that are simply dealing with depressive symptoms. You haven't been diagnosed. You've just been feeling a little down. You've been feeling a little blue. Everybody wants to know what treatment is available. Well, number one, I always tell people, like, listen, keep God at the center of everything. But at the same time, God doesn't always work in supernatural ways. Okay. So just because you pray and fast doesn't mean, if you're dealing with depression, God doesn't mean he always just going to poof and cure your depression. There may be instructions that he released to you in the midst of your fasting and your praying and your scripture study that may guide you to where you need to go to initiate that healing and wholeness. So always start with prayer. Always start with the word of God, and having a support system of people that are very mature spiritually. Okay. But then also we need to have wellness tools in place. I'm going to say this because it's true. A sedentary lifestyle, and we're going to get to the exercise, but I want to mention this, and then I'll jump back to the wellness tools. A sedentary lifestyle is a friend of depression. Okay. So you can't afford to live a sedentary lifestyle. That's an inactive, a lazy lifestyle, because you become prime target, or that becomes the prime substance for depression developing within your life. Okay. But wellness tools are like journaling, meditation, yoga, just kind of hanging out, disconnected, unplugging yourself from media, turning off your cell phone, getting off of Facebook. You're not watching YouTube or Netflix. You're just kind of chilling and relaxing. Then also it's important to rest. A lack of sleep is a lot of times why people are depressed or dealing with depressive symptoms, because you're not resting and your body is not having a chance to replenish. Now, psychotherapy. Of course, none of these in any particular order, because your treatment plan for depression is going to look different than, per se, if I was dealing with depression. Okay. So everybody's treatment plan is going to look different, but everybody, no matter the level of severity, needs to have wellness tools in place. You need to be journaling. You need to make sure that you're taking time to meditate. And when I say meditate, I'm not talking about and you're sitting with your feet in a circle. Meditating is just really coming outside of society, going into your own space where you can have some peace and quiet. Like I said, turn off your cell phones, turn off social media, turning off of Netflix. You're not watching any of that. That's meditation, where you can just think and just process and just even relax and rest. Okay. So everybody, no matter the severity of what you're dealing with, you need to have wellness tools in place. And I definitely advocate for journaling for a couple of reasons. Number one, it's a therapist and counselor recommended tool. And number two, when you don't always want to dump on other people the things that you're dealing with in your life. Okay. So when you're dealing with depressive symptoms or depression, having that journal outlet can help you manage your stressors much better than internalizing. Because I don't want you to hold everything in, because internalizing does no good, because internalizing will break your body down. Yes, you can develop heart disease, you can develop ulcers, you can develop pulmonary problems and everything else from stress overload, or the scientific term is distress. Okay, so you need to have wellness tools in place, everybody. And don't be afraid. Now, psychotherapy. Don't be afraid, like I said, to see a therapist or a counselor of any sort, whether it's a grief counselor, whether it's a mental health therapist. It don't matter what, you have to find based on what it is that you're dealing with. Psychology Today. Psychology Today. And then you can go on and find a therapist. You can find any type of therapist that you may want. Okay. Any therapist. If you're looking for a Christian therapist, you can go to Psychology Today, find a therapist, and you can type in, I want a Christian therapist, and it'll populate. And then you can begin to do research on the backgrounds of people. It's okay to see a therapist. It's okay to see a counselor. It's okay to be involved in peer and family support groups. Doesn't take away from your faith in God. Doesn't minimize who you are in God. Because God positions people to help us along the path of healing and wholeness. And like I always say, it's amazing how people, they break their arm, they injure their knee, they injure their shoulder, they have circulation problems, they have osteoporosis, they have heart disease, whatever, they have stomach cancer. You're going to pray, but you're going to go to the appropriate specialist to receive treatment. Why? Because they have what they need. Your ultimate faith is in God, but they have the expertise and the knowledge to help you along the path of healing and wholeness. Okay. And going to see your doctor doesn't take away your faith in God, because that could be what God is revealing for you to do. That's the wise thing to do, because the Bible says wisdom is the principal thing. So psychotherapy, it's okay. It's okay to have faith in God and also see a therapist and a counselor. You may need to be on medications, including antidepressants, but be careful with medications. Some people need them. Don't take it just to take it. Antidepressants, mood stabilizers, and antipsychotic medications, because they can create other issues as well if you take it and not need it. Okay. And some people, believe it or not, lie and stretch their symptoms and things just so they can get on medications for that easy relief. So be careful with that as well. Like I said, exercise. You have to exercise, because a sedentary lifestyle is a friend of depression. If you live a lazy, inactive life, guess what? You're a prime target to inhabit depression. And usually it'll lead to clinical or major depressive disorder. Something else, light therapy. And like I said, I don't know, for those that are going to come in later, I kicked it off with either circle everything around God, because in our times of prayer and fasting, getting in the word, seeking counsel from other people, talking, we can receive the wisdom that we need. Okay. Because I mentioned this on a live that I did last week. Sometimes people think when we pray to God and have faith in God, he's just going to supernaturally poof and knock our conditions away. But that's not always how God works. There are times where he does things divinely, but that's not all the time. Sometimes God, he reveals, more often than not, he reveals instructions and things we ought to do during our prayer time and our fasting, our time of getting in the word, of what we need to do to better our situation. Okay. So yes, it is possible that God may be revealing that you need to see a therapist or a counselor, or you need to start exercising more, or you need to put wellness tools in place. Okay. Yes, he reveals those things. But something else on the scientific tip, light therapy, which uses a light box to expose a person to full spectrum light in an effort to regulate the hormone melatonin. So light therapy, is another considerable factor in treatment against depression. Okay. And then you have alternative approaches, acupuncture, like I mentioned, meditation. I put that more so in the wellness tools. And then your nutrition. You have to watch what you're putting in your body, people. Okay? Because you can go to a therapist all day. But if you're not doing what you need to do in your personal life, that's just like someone that goes to the gym 5-6 hours a day, work out hard, but then they go home and eat crazy and have other bad habits. Everything that they do in the gym is going to be undone. So even if you're going to see a therapist, counselor, you're in peer and family support groups, if you're not doing right by your nutrition, your exercise, wellness tools, guess what? You're not going to get better. All of this works together. Okay? So remember, everybody's treatment plan is going to look different, but the fact remains, you need to be educated in what treatment and what treatment options and wellness tools are out there. What mental health professionals will be appropriate. Again, go to Psychology Today, find a therapist, look for a therapist. I pray prayerfully you have insurance. If you don't have insurance, you can Google certain things in your area, because there may be peer and family support groups or mental health advocacy organizations. There's one that's called NAMI, N like Nancy, A like Apple, M like Mary, I like India, NAMI.org. That's the National Alliance on Mental Illness. They can link you up and be a source of help with resources for depression, anxiety, schizophrenia, eating disorders, and every other mental condition. They can also link you up with peer and family support groups. They can also link you up with mental health professionals. You can reach out to my organization, Journaling Saves Lives. You can email us journalingsaveslives@yahoo.com. If you need some mental health resources, we can email some resources to you. And then also, if you need help locating a therapist, or you just need to talk and you need some direction, reach out to us. We'll make sure you get the right information, that we put you in great hands. Okay. So I pray that everyone comes back and watch this video. This is the first day of Mental Health Awareness Month. All right. And we want to make sure that we are educated about depression. Okay. That was our topic for this week. Hear this. Stop telling people, if you're a Christian and people present to you with depression and any other mental health disorder, stop just telling people, just pray about it and God will work it out. Because the Bible declares there's safety in a multitude of counsel. You need to get people that need help into the hands that can help them. Yes, God works it out, but God uses people to work it out in our lives oftentimes, okay? So everyone have a wonderful day. Please go back and share this video. It was more educational, more so than ministry-wise, but I just want to kind of throw it in there. Church people, Christian saints, however you want to term yourself, it's okay to have faith in God and see a therapist. It's okay to have faith in God and see a counselor. It's okay to have faith in God and participate in mental health, peer and family support groups. And if you're a person that's not dealing with depression or any mental health disorder directly, but you're dealing with it indirectly, guess what, people? You need help too, because you can begin to develop firsthand clinical depression or depressive symptoms if you're not proactive while trying to assist someone else who's dealing with it as well. All right. Everyone have a wonderful day. Connect with us on Facebook, Journaling Saves Lives, House of Love Ministry. Please, our Cash App information and our emails is in the caption of this video. Please consider sewing because we do a lot for the mental health field, in society, not just in South Florida, but all over. And then we need you to sew because of our outreach efforts to support the people that have fallen into homeless conditions, because we give mental health resources to them. We don't just feed the homeless. We don't just pray with the homeless, but we direct them. We give them information with regards to mental health resources. All right. So I'm going to end this live. It's been real. Everyone, please remember, this is Mental Health Awareness Month. Get educated. Your friends, family, and loved ones, people need you to do more than just simply calling and check on them. Because if you're calling and checking on me and you don't have what I need, or you can't even point me in the right direction, you calling and checking on me ain't going to do very much. All right. So make sure you're educating yourself in wellness tools and things. So when you do call and reach out to people, or if people come to you, guess what? You'll have what they need. All right. Everyone have a great day. Happy Mental Health Awareness Month, the whole month of May 2020. Have a wonderful day.